Hi, everyone. Thank you so much for joining us today. I am going to start by introducing our Senior Director, Melissa Mercado Crespo, who's going to give some welcoming remarks.
Thank you, Tom, and hello, everybody. Welcome to this edition of our webinar series. We're so excited to be here. It's going to be a great session and one that is focused on a key critical component of firearm injury prevention research, which is community building. How do we build community partnerships upon trust? As Tom mentioned, my name is Dr. Melissa Mercado, and I serve as Senior Director of the Kaiser Permanente Center for Gun Violence Research and Education. Next slide, please. As part of the Health Alliance for Violence Intervention, or the HAVI, our center endeavors to transform the firearm violence research and education field. We're seeking a future free from firearm violence where communities are the ones that lead the way. We do this by partnering with communities that are disproportionately impacted by firearm violence, by uniting rigorous scientific discovery with community-led approaches, and also through funding research and education initiatives that empower communities to create solutions to this national epidemic. Our center operates in the five key areas that you see on the screen: advancing knowledge, clinical innovation, community building, data for action, and inclusive grant making. And we do this to drive systemic change, narrative change, and lasting impact. Next slide. Now, it will be remiss of me not to share with you a great center resource that is being officially launched this week. It is our new prevention and intervention library. You know that people at risk of or that are recovering from firearm injuries, they often interact with healthcare teams during critical moments. And those critical moments provide an important opportunity for care, for connection, and for support. As such, this curated online library highlights those evidence-informed, health-focused approaches to prevent firearm injury. It provides examples of strategies that are connected to the healthcare settings that promote the health and well-being of individuals, families, and communities, and address those factors that increase the risk for firearm injury or firearm-related deaths. You can access this resource free of charge on our website, kpcenterforgunviolenceresearch.org/interventions. Next slide. Also, if you're interested in learning more about one of those types of violence interventions included on the library, HVIPs, the Hospital Violence Intervention Programs, I invite you to visit our HAVI website. In fact, the HAVI membership application cycle is currently open with a deadline of March 13, 2026. You can learn more about membership categories, eligibility, and benefits at thehavi.org. Next slide. Now, before I pass it on back to Tom, I'd like to invite you to subscribe to our e-newsletter with the QR code that you see on the screen or by visiting our website. In that listserv, you will learn about upcoming webinars, and there are plenty planned with great presenters and providing amazing information to help us in our work, as well as other resources and opportunities to grow and spread the word about what's new and what works in firearm violence and firearm suicide prevention. Once again, thank you so much for joining us today. Tom, back to you.
Great. Thank you, Melissa. And thank you all so much for joining us for this webinar today. We're very excited. Our focus today, as Melissa said, is a webinar titled Built on Trust, Community Partnerships for Firearm Violence Prevention. My name is Tom Simon. I'm the Senior Advisor for the Kaiser Permanente Center for Gun Violence Research and Education. And I want to say that this webinar is part of a series that the center is hosting. Next slide, please. And just to provide a little bit of background on the series, our center is committed to addressing gun violence as a public health issue through evidence-based, equity-centered, and community-informed approaches. This webinar series reflects that commitment. We've learned a lot from our grantees and applicants for our research funding about the research priorities that matter most to them, as well as some of the challenges that remain for them and for the larger field. So this series is intended to respond to those priorities and challenges by providing practical information on a range of topics relevant to firearm violence prevention research. The series is part of a broader effort to bridge the gap between research and practice and support the work that reduces firearm-related injuries. Next slide. So this is actually the third in the series, and this slide shows the full set of webinar topics. One of the things that we're doing is across each session, we're bringing together multiple perspectives with at least two speakers who reflect research and practice That balance is really critical for the field and to us because meaningful progress in firearm violence prevention really depends on a strong connection between research and practice. I want to say I'm honored to co-lead the entire webinar series with Dr. Ruth Abaya, who serves as our senior clinical advisor. And we're especially excited about today's topic. The need to build trust and sustain trust is really critically important in firearm violence prevention research because so many communities that are most affected by violence also have an experience of a history of harms, extractive research practices, and broken trust. So, as a center, we're committed to doing research in ways that are equitable, respectful, community informed, and to supporting others in doing the same. And I'll just say I'm really pleased to be joined today by three outstanding experts who've agreed to share their experiences and insights with us on strategies for building strong, trust-based partnerships with communities to support meaningful firearm violence prevention research. So first, I want to introduce Dr. Kathryn Bocanegra. Kathryn is an assistant professor at the Jane Addams College of Social Work at the University of Illinois, Chicago. She brings more than 18 years of experience in community mental health, violence prevention, and criminal justice reform. Her work focuses on community violence prevention, trauma and bereavement, supporting survivors of violence, and examining the intersection of the criminal justice system with urban neighborhoods. Kathryn's received numerous research awards and has published extensively on these topics in collaboration with communities and with trusted partners. And we're fortunate today to have Kathryn joined by two of those partners. First is Kelly Carroll. Kelly is the Associate Director of Behavioral Health and Wellness at the Institute for Nonviolence, Chicago. She leads initiatives to strengthen trauma responsive practice across community violence intervention efforts. Kelly has more than 15 years of clinical experience working with individuals affected by violence, housing instability, medical trauma, and PTSD. She previously focused on military veterans and their families, and she brings a strong interest in supporting violence intervention professionals who face chronic stress and trauma. She also teaches part-time at the University of Chicago Crown School of Social Work. We're also very fortunate to be joined by Edwin Galletti. Edwin serves as the executive leader of violence intervention and prevention services at UCAN in Chicago. Edwin oversees a team of more than 100 staff delivering integrated, evidence-informed programming in several of the city's highest risk communities. He brings more than 2 decades of leadership grounded in both professional expertise and lived experience. And as you'll see from his presentation, Edwin is deeply committed to building relationships that promote healing, safety, and opportunity. Kathryn is going to start us off, and then Kelly and Edwin. And after that, we're going to have some time for Q&A with the entire panel. So for everyone joining us today, please feel free to submit your questions at any time using the Q&A feature, okay? With that, Kathryn, are you ready to get us started? All right. Thank you so much. I'll turn it over to you.
And thank you so much for the introduction. I'm really thankful to be a part of this incredible series with other prolific researchers, excellent community partners, and most appreciative to share this space with Kelly and with Edwin, who I have tremendous respect for and who are doing incredibly impactful work in Chicago. As a preface to what I'll be sharing, there are some photographs that I will be using on slides that have sensitive content that show scenes in the aftermath of violence. These were taken by Carlos Javier Ortiz from a really beautiful photography exhibit, We're All We Got. So I want to give a preface that some of that content could be triggering, but the point is to depict the realities of building trust in high stakes environments with people who've been disproportionately impacted by violence in their communities. Next slide. So while I'm coming to you today as a researcher, I have worked in community violence intervention, as noted in the introduction, and community mental health for many years, and continue to try and keep those threads of practice and direct relationships alive, even in a research capacity. When I was still in community practice, working community violence intervention, this photograph represents one moment among many that altered the trajectory of my career from moving from practice into research. At the time, I was serving as the director of violence intervention at Enlace Chicago, which is a community development corporation on Chicago's Southwest Side Little Village community. And my training was in clinical social work, and I was at that time supervising a team of street outreach workers. A young adult that I knew in our programs was shot in the neck and killed on a Friday evening when he left a friend's house. And the next day, there was a vigil in the exact location where his blood still stained the sidewalk. And around that spot, there were about 50 young men and women, many who were affiliated with neighborhood gangs, that formed a really tight perimeter around the candles and the posters and the bereaved mother of the victim. They were grieving and angry, and they were traumatized. And his mother stood before them and publicly forgave the person who killed her son, begging them for no retaliation because she would not wish her experience on anybody or any other family in her community. The Monday after that shooting, his outreach worker, who was bereaved and who had been with him hours before his death, lost his composure at a school where he ran after school programming with youth who were in detention. His team was demoralized. They were carrying cumulative trauma. The mother of the victim did not receive any timely communication from the detectives. And over the next year, I watched that about half of the peer group of this young man who was killed also died violently. And in that moment, I was looking for guidance and support in research. I was looking for guidance on how to stabilize a traumatized outreach team. I was looking for how to interrupt cycles of retaliatory violence. I was trying to figure out how to support a bereaved mother navigating investigative silence. And I was trying to think strategically about preventing the next death. And what I found instead was fragmentation. When I looked at the research, I found that gang literature largely did not account for traumatic bereavement. The trauma literature did not account for street dynamics. The criminal justice research that measured clearance rates did not account for the survivor perspective or relational rupture. And the prevention studies largely did not account for community violence intervention work, much less the trauma they experienced. So while the lived reality was integrated, the scholarship was tremendously siloed and incomplete. And that disconnect was not just theoretical, it had consequences, because I realized that when research fails to reflect the lived complexity, practitioners like myself at that time are left improvising under crisis conditions. So when scholarship does not map onto reality, trust erodes, not only in institutions, but in research itself. And that realization is what moved me into research, not to observe, practice from a distance, but to produce work that would attend to those ruptures in knowledge and best practices that I experienced. On to the next slide. My career has spanned direct service, government advisory roles, and law enforcement training. I've been involved in policy reform, and my research sits at this critical intersection of violence, trauma, and punishment to examine how systems respond to harm and how those responses can even unintentionally reproduce it. So I focus on community violence intervention, workforce trauma, homicide investigations, the impact of long-term incarceration, all connected by questions of legitimacy and trust, which we're going to unpack today. On to the next slide. And so for the commitments that I'm hoping that my contribution, but especially I know you'll learn from Kelly and Edwin, that build a collective knowledge base here is that trust is not an interpersonal nicety. It is a determinant of data quality, implementation success, and translational credibility in gun violence prevention research. I hope that we move beyond the language of engagement to examine what sustained partnership demands structurally, which includes reciprocity, shared interpretation, and accountability beyond funding periods. And finally, I hope that we will consider how power operates in research relationships, how things like institutional affiliation, analytic framing, and even positionality shape who participates, what is disclosed, and whether findings are seen as legitimate by practitioners. This is what I hope you walk away with at the conclusion of today's session. On to the next slide. As many of you know, if you're connected to this series and listening to the experts in the field, you know that firearm violence remains a leading cause of death for young people in the United States, and that communities affected are navigating ongoing loss, trauma, and instability. So research in this space is not theoretical, it sits alongside active harm. And I take that very, very seriously in my position as a researcher. Because the stakes are high, I think that firearm research must be reflective and ethically grounded and actionable, and that poorly designed or misaligned studies can misdirect resources, reinforce flawed assumptions about people or communities, or erode communities' willingness to engage in future research efforts. So our efforts, our actions have ripple effects. In this field, rigor includes relational responsibility, which you'll hear more from Kelly and Edwin. We are working in environments where trust has already been strained by multiple systems, and that reality cannot be treated lightly. Trust operates at intersecting levels between individuals, organizations, institutions, and communities with long memories of prior engagements. This is something that I encounter frequently doing community engaged research in Chicago and other parts of the country, where someone brings up a past experience with a past researcher or a past research center or a past university. And even though I'm tempted to say that wasn't me or that wasn't my university, I hold myself accountable to the actions of others because we reflect a collective. When a survivor or practitioner engages in research, they are not evaluating a single person. They're not evaluating just me. They're assessing the university or the hospital system that I represent, or past studies in their neighborhoods and how their community has historically been treated. And if trust fractures at one of those levels, it reverberates across the collaboration. So I think in violence research, these layers are really inseparable. On to the next slide. So this is an important question that we all ask ourselves if we assume a research position tuned into this webinar. I ask myself if I am contributing to harm, or think and reflect if the institution I represent has actively contributed to past harm. There's a report here that I love referencing every opportunity I get to, which is produced and compiled by Chicago Beyond, a social impact organization in Chicago, called Why Am I Always Being Researched? A Path Towards More Equitable Research. And it is free for download, and I encourage you all to check it out. At times, I think that violence research has drifted into what we call trauma voyeurism, centering graphic narrative detail that captures attention, but does not necessarily translate into structural change. When suffering becomes a primary object of the study, I think that dignity can erode. There's also a risk of episodic spectatorship, brief institutional entry into high violence neighborhoods to collect stories or data or pilot results, followed by an exit by the researcher or their institution. And communities experience this pattern as extraction rather than partnership. Poverty, resilience, and even violence itself can be romanticized by researchers. We sometimes celebrate community strength or resiliency in ways that obscure constraint, or frame neighborhoods as uniquely violent in ways that flatten internal variation or all the beauty and good that coexist alongside violence in some communities. Master narratives then can harden over time about gangs, about retaliation, about cycles of violence, distrust of police, or non-cooperation. And when these narratives become dominant, they can silence nuance, overshadow contradictory evidence, and limit the questions that researchers even think to ask. And these dynamics are rarely about malicious intent. I do believe anybody who dedicates themselves to work as a practitioner, as a policy advocate or researcher in this field is all trying to do good. But they also reflect incentive structures, funding cycles, media amplification, and publication norms that reward clarity and coherence over complexity. On to the next slide. Sometimes I think that positionality often turns into an autobiography or a confessional standpoint of, well, I'm here as a researcher, but I grew up in the suburbs, or I have lived experience, or I care deeply, and all of those things matter. But if a researcher is aiming to build trust, to develop impactful research collaborations to reduce firearm violence, we have to move beyond autobiographical confessional statements and reflect on if we are centering ourselves rather than institutional power that we represent. I think universities in particular carry complicated histories. I know the university that I am employed by has been involved in the displacement of marginalized communities in Chicago. And I don't forget that because the people who I work with in community experienced that with the expansion of our campus. In many cities, they have expanded into surrounding neighborhoods, displaced long-term residents, shaped housing markets, and supported the policing practices that push out local community in the name of protecting students. And that history travels with us when we enter into community spaces. So what I want you to take away is that I don't think communities are always asking for a confession. They're asking for clarity. What are you going to do with this data? What happens when the funding ends? Positionality becomes meaningful when it addresses those institutional realities and moves beyond your personal identity. So on to the next slide. I want to share a story from one of my research projects, the criminalized survivor, examining systems, policies, and practices that reproduce harm. This project emerged from working with a mother whose son survived a shooting while he was on parole. He had been shot multiple times. He was hospitalized. He was clearly a victim of violent crime, and his brother had been killed the year before. This family was already navigating profound loss. When they attempted to access crime victims' compensation to cover medical costs and lost wages, they were told he was ineligible because of his legal status, because he was on paper. He was recognized as a victim in the emergency department, but disqualified as a victim by Illinois policy. I remember her looking at me, saying very plainly, in the context of our research interview, I'm really glad you're asking these questions, but what are you going to do about it? There was no patience for like theoretical nuance or, well, here's the aims of this project, but maybe afterwards. Her message was really clear to me. If the system says my son is not a victim, then what good are your categories or what good is your project? And if the university is studying this, where's the remedy? And I don't think this was a message of hostility, it was of accountability. I represented an institution capable of analyzing policy, but she was asking whether we would confront it. And if the system could already deny that her son had been shot after bearing another child, what exactly are these protections, hypothetical protections offered through state policy worth? So for this family, harm was not a single event. It was layered, interpersonal, cumulative, and administratively sustained. And that's where like systems categories, victim, offender, and parolee were mutually exclusive in law, but the lived reality integrated all of these experiences. And that confrontation is what shaped the line of research that proceeded. We realized that we couldn't just gather narratives and make claims on how victim policies in the state or at the federal level and victim services created these cracks in which the family that you see pictured here was disservice, but rather we needed to create a guide of what rights and access routes were available to the family so that advocates could expand upon existing eligibilities and challenge policies that excluded families like hers. That conversation with this particular mother translated into a website, which is, to the best of my knowledge, the first and only state database of all victim law that is survivor-centric, interpreted and organized in a way that's meaningful for survivors. And if you go to www.il-survivors.org, which I'll make sure is dropped in the chat, this policy database I dedicate to this mother who challenged me in that ethnographic, community-engaged research. What are you going to do about this afterwards? That policy database has now an afterlife that includes advocacy and expansion of services. On to the next slide. So to move on, trust is not synonymous always with community-engaged research. You can run a RCT or a secondary data analysis or a qualitative study and still operate in ways that either build or erode trust. I want to emphasize here that relationship building is often unfunded labor. It begins before a proposal is written and continues long after a grant closes. And communities can tell when engagement is tied to a funding cycle. When presence disappears with the grant, I think the credibility of the researcher and the institution erodes, not just for that project, but also for future collaborations. Then the next slide. So the essential ingredient that we keep centering on here is relationships, the mechanism through which trust becomes durable. They shape whether community knowledge is treated as authoritative, whether lived experience is interpreted with care, and whether research questions are co-developed rather than imposed. And I see this so clearly in Edwin's leadership, balancing staff wellness, professional development, and deep community accountability, and in Kelly's work, bringing rigorous trauma science into CVI settings in a way that strengthened frontline practice rather than sitting adjacent to it. Moving on to the next slide. To embody some of the concepts that I'm sharing here and to wrap up my component, I want to talk briefly about a separate project called Life After Death, a survivor-centered examination of homicide investigative practice. For years, I've been facilitating support groups for families of homicide victims. And these were not research spaces initially, they were grief spaces. And that's where they taught me lessons about traumatic bereavement following violent death. The families were not only grieving the loss of their loved one, they were navigating investigative silence, inconsistent communication, and deep uncertainty about what was happening with their case. Clearance rates did not capture the lived experience of the system. So when I came into my role at UIC in 2021 with the support of a 2-year grant from the Joyce Foundation, I formally launched the project Life After Death with my co-principal investigator, Dr. Julian Thompson. The grant concluded in 2023, but the work did not. The survivors that I had built a relationship with became the Survivor Advisory Council that oversaw all aspects of the project. They helped design our research questions, interpret data, and then they co-presented data with us in research conferences and to the Bureau of Detectives when the grant concluded. Now, together with these survivors, we developed a new training curricula for lead homicide investigators for the Chicago Police Department. Since 2023, unfunded, but in continuity with that in-depth community engagement, I'm bringing survivors into lead homicide investigator training to change the way investigators or homicide detectives engage family members and community members after violent death. The research they co-created with me and their experiences now inform their training and their practice in their community perspective. And I've continued this work beyond the grant because trust and institutional credibility cannot begin and end with funding cycles, and survivors deserve to shape how the systems that affect them evolve. So to wrap up my component, I want to just acknowledge there is a tension that researchers who want to build trust and do community engaged research have to navigate. On the next slide is the pendulum between detachment and over-identification. Detachment and over-identification. All right. Too much distance can be experienced as indifference. Too much proximity can blur analytic boundaries. And the task is not to eliminate that tension, but to navigate it transparently and ethically. And ethical rigor, I think, requires managing multiple asymmetries at once: methodological integrity, relational accountability, institutional power, and lived experience. And the goal is not neutrality in the abstract, but disciplined reflexivity that strengthens both trust and validity. So with that, I'm really excited to hand it over to Kelly, who's going to talk about some of aspects of our community collaboration and her expertise in trauma recovery and community violence intervention practice.
Thank you so much, Kathryn. I just want to say I'm incredibly grateful to be here today. And so I have so much gratitude to Kathryn for inviting me to share my experience, which is also a lot of shared experience working with her, as I'll talk about today, but really, really grateful for this opportunity. And I want to start from a place of echoing a lot of what Kathryn's already said, which is thinking about when I consider the idea of what community engaged research or community engaged practice is, the first thing that comes to mind is relationship. And relationship is the key of and the core of all of the work in community violence intervention. It's the foundation through which outreach workers engage participants that are at the highest risk of engaging in gun violence. It's the foundation of how the staff members in a CVI org are able to work together to be effective in this really, really challenging work. So trust is so essential and foundational to everything that we're doing in our work. So it simply makes sense that when research enters the space, it's either going to strengthen the trust or erode it. And if researchers ignore that, then we're really just misaligned with the way that the work operates in the field. Earlier in my career, I worked at an academic medical center where I had incredible opportunities to get exposure to being involved in different research projects and incredible evidence-based training and treating survivors of trauma. But I was still sort of finding my footing on what I wanted my work to look like. And there was always some aspects of that that didn't quite feel like it fit. And as I have gotten into research in the CBI space, I've found that it really feels fundamentally different. And so I'm really excited to have the opportunity to share what my journey has been as a part of research and practice partnerships in the CBI field and what made them feel like true partnership. Next slide, please. So my first involvement in CVI research was actually as an interviewee for a study that Kathryn was doing. At the time, I was working at Chicago Cred as a trauma specialist, and I was observing something in real time, that the trauma exposure that the CVI staff were experiencing didn't fit neatly into the frameworks I'd been trained in. I'd been trained a lot about PTSD and complex PTSD and secondary traumatic stress and vicarious trauma. And none of those was fitting what I was seeing in the staff that I was working alongside and training in these evidence-based practices. It was something that was closer to ongoing, chronic, and cumulative exposure to violence without any sort of recovery window. And so when Kathryn actually interviewed me as a part of her Between a Bullet and Its Target study, she was kind enough to share a lot of the findings that they had come to in their data collection. But then she asked me my thoughts about it. And she asked me, did it fit with what I was seeing on the ground real time and in the work I was doing? And she invited me to share my own interpretations based on my practice experience and my trauma experience in the background. And it totally shifted my understanding of what community engaged research could look like. I wasn't just someone who was symbolically advising. I was someone who had a perspective that mattered and could contribute to the way that the findings were contextualized. And then she did something even more surprising. She invited me to be a part of the research team. And said, I think that your insights and your experience are so valuable. I want you to help us contextualize our findings. It really just changed my perception of what research could be. And it was the first time that I really felt like my practice experience felt seen and heard and was recognized as having value. And so that experience really has shaped how I have approached research and partnerships in my role at the Institute for Nonviolence Chicago. Next slide, please. So one of the first projects that I engaged in when I started my role at the Institute for Nonviolence Chicago was a staff wellness initiative. And when we launched it, it wasn't framed as a study. It was really framed as a need. We knew that our frontline staff were carrying enormous trauma exposure that was in the past, as well as related to the job, as well as ongoing outside of the job, just in living in the community. And so we started from a place of not asking, rather than asking, how do we measure trauma exposure? We knew that there was trauma exposure. The real question was, how do we take care of our people? That was the question that we wanted to answer through our research. And so we knew if data collection was going to be a part of that work, we didn't want it to be top down. I fundamentally believe those closest to the problem are also closest to the solution. Next slide, please. So as we began to build out our wellness initiative, we built a wellness committee that was made up of staff across different roles and sites. And they weren't just advisory, they led the work. They helped to design and determine what questions were asked of the team in our all staff survey. They helped shape what language felt right. They helped us determine when and how data was collected, and also how the findings were shared back in regular intervals. And then when we had some recommendations that came from our data collection, they helped to shape what changes were prioritized as we implemented an action plan. We also partnered with an outside researcher of Corners at Northwestern in a different way that I had seen. So they were doing a process evaluation of our staff wellness initiative, and they embedded themselves in the wellness committee. They attended meetings, they observed the process, and the goal of them doing a process evaluation was really to help us make sure we were learning as much as we could from going through the process that we went through. We knew there was a lot to learn there, and we wanted to be able to capture as much of it as we could. So throughout this, the research emerged from the practice. The surveys were co-designed, the timing respected the workflow, findings came back regularly in conversations and in meetings and in program adjustments, and staff really shaped the process, not just the outcomes. And this to me was research in service of care. Next slide, please. In my time at INVC, we've also built a partnership with Rush Academic Medical Center on multiple fronts, and we've modeled these partnerships based on what we've learned through our other efforts. So in each partnership, the relationship comes before research. First, we have medical residents that are a part of Rush's health equity track who do 2-week rotations at INVC, and they don't just observe. They come, they sit in our workforce development classes, they spend time riding along with our outreach workers in the community, they hang out in the office, they build relationships with participants, and they in turn also offer education around preventative medicine and regular routine medical issues. And the focus here is mutual exposure. They are learning from the community and they share their medical insight in return. Another partnership we have is we have 2 fellows that are embedded with our behavioral health team that are a part of Rush's social work department. They spend 2 days a week with INVC for 2 full years, and that duration really matters. It allows them to form trust with our organization, to understand the culture, the pace, the complexity of the work, and the relational dynamics, and then to really have longevity in their work with participants that they work with. And a third project we partner with Rush on is through a couple psychologists that are part of the Road Home program. They have 2 different research grants that we've partnered with them on with a very intentional design. Each project has a paid frontline co-research lead. So that is a person from our frontline staff at INVC who brings their lived experience, their community credibility, and all of their contextual insight into every stage of the work. They are paid and stipended a significant amount. It's not like $100 stipend. It's a significant stipend, and they make a year commitment to really advise and guide this work. We also convene a community advisory board for each of those, composed of staff, participants, community members, and they really guide the project and are compensated for their time as well. We really want to acknowledge that expertise and lived experience are forms of labor. And I'll say none of these projects are perfect. They require a lot of ongoing negotiation and iteration and a lot of staff time and capacity, but it really reflects our commitment to continuing to build partnerships that honor both academic rigor and community wisdom. Next slide, please. So the third project I'll talk about that I'm probably most excited to talk about is Project Strive. And this is one that Kathryn and I are co-leading. And this has been sort of a culmination of sorts of the learnings of all of the previous experiences. So with some really generous funding from the Steens Family Foundation, Kathryn and I have co-designed this study alongside a community of CVI clinicians. And this project is piloting 2 evidence-based trauma treatments, narrative exposure therapy and EMDR in the CVI setting. Historically, trauma treatment trauma-focused treatments haven't really been utilized in the communities we serve, and trauma treatment research hasn't really centered the communities that are experiencing ongoing gun violence because of so many factors that make it hard to fit them into what traditional research looks like. And so what felt really different here was proximity and transparency from the beginning. At our kickoff meeting, Kathryn gave a really thoughtful overview of how she approaches research differently than the traditional model, which she shared with you all. She named the power dynamics openly. She acknowledged the history of extraction, and she was very clear that the goal of this was collaborative learning. And that really mattered. As several of the clinicians who were a part of that kickoff meeting, who were a little bit ambivalent going into it, later shared with me that it was that part of the kickoff, it was that conversation, that tone that made them want to participate in this study because they wanted to be a part of research done differently. It wasn't about the stipend. It wasn't even necessarily just about getting free training in really great models. It was the fact that this research was being done with them, not to them. Additionally, Kathryn's been embedded in all of the trainings, not observing from a distance, but present, listening, taking notes. And as she's developed the methodology, the clinicians have been asked for their feedback on the study measures. So the design has been incredibly responsive, and that's built trust. The clinicians have been a part of not just implementing the interventions, but shaping the process of inquiry itself. Next slide. So what made all of these things feel different? I think there's three things I want to highlight in these experiences I've shared. One is that proximity is not just physical presence. Proximity is relational closeness and contextual understanding. In all these projects, the researchers were deeply embedded in trainings, in meetings, in side conversations. They saw how exhausted practitioners were at the end of long days and how workflows actually functioned. And that changed the quality of the questions. They weren't interpreting behavior without context. Reciprocity is another key thing here. In these collaborations, the findings came back very quickly and the data was translated into action and adjustments were made in response to what folks were shared. The survey results from our Staff Wellness Initiative informed a lot of policy changes. And in Project Stride, the clinician feedback has shaped how we measured and implemented what felt reasonable. I think reciprocity also meant acknowledging what participation costs people: time, emotional energy, vulnerability, and compensating the folks doing the work for that, which is a huge piece. And then finally, I think this might be the most important one. There's an element of the shared authorship of meeting. In traditional models, researchers analyze data and produce conclusions, and community members are often just quotes or statistics. But shared authorship really shifts that. So between a bullet and its target, I was invited into the interpretation. And in Project Strive, clinicians are shaping how we understand feasibility and impact. So shared authorship means that interpretation is collaborative, and that changes the power dynamic because meaning making is power. And when practitioners are a part of interpreting their findings, they're not being studied, they're contributing knowledge. That's when people say, I felt seen, not just because they were included, but because they influenced what the research ultimately said. Last slide, please. So what I want to propose here is that truly community engaged research treats trust as a part of the methodology, not as a byproduct of the methodology. The quality, the validity, the depth of the data and knowledge produced all depend on the quality of the relationship between the researchers and the community members. And it slows down long enough for people to be seen, because in the communities that are shaped by structural and community violence, being seen accurately, respectfully, and with complexity, it's not a small thing. So thank you so much for the opportunity to share my experience. And I think I'll pass it along to Edwin to share with us his as well.
Thank you, Kelly. Thank you guys for having me. And I appreciate the kind words and thoughts for our team member who lost their life last Friday. So thank you for that. So bear with me. It's been a very difficult week for each of us. So I'm gonna get started. My name is Edwin Galletti. I am the Vice President of Violence Intervention and Prevention Services here at UCAN. I've been with UCAN for 3 years. I've been doing the work for over 20 years in some of Chicago's communities. At the moment, I am proud to say that I lead a team of over 250 individuals throughout Chicago. Just to put some perspective to that, two of the 7 communities that we had worked in this past year that contributed to Chicago's record decline over the past 60 years was 2 of the communities that we service as well. Just to put some numbers behind the work we do. So UCAN's VIPS model, what is it, how it lives on the ground? At UCAN, our violence intervention and prevention model is grounded on one core principle: relationships drive change, but structure sustains it. Our VIP model is very comprehensive. It's relationship based for violence interruption. We provide intensive case management, community credibility as a strategic asset, strong hospital and community partnerships. But what makes our model distinct is how it lives operationally. We have clearly defined roles and expectations for our teams. We have structured supervisions and case review processes. Performance benchmarks are tied to engagements and outcomes. Documentation systems that balance accountability and field flexibility. Just want to be clear, this is not an ad hoc approach for street outreach or victim advocacy or anything that we do under our hub. It's structured, it's intentional, and it's continuously refined. Our staff are not just responding to crises, they are implementing a disciplined model with fidelity. How we do that, next slide, please. Oh, next 2 slides. Sorry. Okay. So here at UCAN, we have a quality assurance team who ensures that we are using our data for program excellence. We take data very seriously. It's not just a number. Each of our numbers are tied to a situation, a person, a feeling. It's not used as a compliance exercise, but more so as a performance tool. So we're tracking participant engagement. For example, we need 4 face-to-faces a month, along with 4 other touches to count as successful engagement for the month here at UCAN. Our service doses. So giving you some of that, of course, we have several programs internally under our Power and Prevention Hub, youth development, workforce development, case management, and other things that individuals get to progress through as they start meeting their safety goals and other things that led them to work with us that have them high risk or at risk. Also, the critical incidents response times and the follow-up. Follow-up and response times are equally important. I think a lot of us talk about responding to a scene within an hour, but as we all know, that the real work is done following the incident and sometimes during the incident, right? Also, real data is used for real problem solving, right? It drives our work. It drives best practices. It helps with supervisory coaching. It also identifies training needs for the teams as well, and it strengthens the fidelity of our model. Also, it helps us identify patterns, adjust strategy, and ensure that the work remains both relational and rigorous. Data at UCAN is not just for funders, it is for internal learning and continuous improvement. Next slide, please. Okay, now I'm going to talk about staff wellness. Kathryn spoke on this some today, and just working alongside of her, I've been able to really understand the importance of staff wellness in this field, and I appreciate her time here. So just want to be clear, frontline violence intervention is high intensity work. Our team is constantly exposed to trauma, crisis response to unpredictable hours, community expectations, moral injury and grief, as well as complex dynamics with law enforcement and other systems. Many of our staff bring lived experience. That lived experience is strength. It builds credibility and trust, but it also increases emotional labor. Burnout in this field is not an individual failure. It's a predictable occupational hazard. For example, when I came to UCAN, I had to ask myself, what does my team need versus what I assumed they needed? There were moments when I realized that more structure alone wasn't enough. We needed intentional spaces for reflection, processing, and support. I also recognize that leadership set culture. If our model urgency only I'm sorry, if we only model urgency and toughness, that becomes the norm. So we had to build something that was more intentional for our team around self-care. Next slide, please. From assessment to professional development series. So I had the pleasure for Kathryn Bocanegra and some other professionals to come out all last year to assess my team and be able to develop the right training platforms and the guides that my team needed for my communities, the service areas, my population. So they were very intentional on coming in. And our collaboration became with listening. We assessed staff experiences. We identified stress points. We explored support systems that could be strengthened. From the process, we developed a structured staff wellness and professional development series included trauma-informed education, emotional regulation tools, reflective supervision practices, dedicated space for staff to articulate their stressors and solutions as well. This is not a one-off training. This is embedded into our own ongoing operations. What made this approach different, it was co-developed, staff's voices shaped the content, tools were practical and immediate, usable. One noticeable shift that I want to talk about when we started working with our teams. When we started focusing exclusively on productivity metrics, supervisors began integrating reflective questions, not just what did you do, but how did that impact you? How are you feeling following an incident? Do you need to speak with someone? This shift alone strengthened the trust and accountability simultaneously in my department. It gave them the sense that we are aware of the work that they are doing. We are aware of the traumas that they are doing. And then we are recognizing it in real time when they're not recognizing it. So that type of that type of interaction with staff is vital for us to not only ensure that they're able to go out and do the work, but that they're able to go home healthy and sound mind. Next slide, please. Lastly, I'm happy to say that UCAN was awarded the technical assistant programming through GASC, which is translating collaboration into a statewide capacity building network. We are hoping to normalize conversations about workforce wellness, encourage structured implementation models, promote data-informed improvement, strengthen peer learning across all organizations. And where we feel that research partnership can assist and be vital in this is that they can help strengthen our credibility in our models, give us fidelity that we're needed to go out to funders and philanthropy and our legislation to continue to show that this work is driving down violence. It would also improve infrastructure. It would help organizations articulate what they already understand intuitively. Um, Lastly, I just want to say this: capacity building is not about expansion for its own sake. It's about sustainability for our field. We have seen record lows across our nation since the government and our legislators and our state officials have supported this work. Is not a coincidence. If violence is going to remain viable long-term solution, we got to continue to invest in its development, not only in its programs, but the people implementing them as well. Structure, data, and wellness are not extras. They are the infrastructure. Thank you.
Tammy, I think we can go to the next slide. So thank you so much, Kathryn, Kelly, Edwin. That was really fantastic. You've given us so much to think about. I loved how there were so many common themes around relationships, around the tension between detachment that we normally bring as researchers and the importance of proximity and reciprocity. I loved how your presentations built on each other. I think we could easily spend another hour if we had it unpacking this and discussing what it really looks like. I was thinking about might be most helpful to our audience, and since we only have a few minutes left, I will tell people in the audience that if they have a question, go ahead and put it in the Q&A, and we'll take a look at it and hopefully get to it. But one general question that I want to pose for everyone is when you think about early career researchers who want to do this work, they're committed to doing it well. but they might lack experience, institutional power to support them. They may not have the kind of long-standing community relationships that they would ideally want to have in order to do this well. What kind of advice would you give to them to get started, to build those relationships, and to um, show their commitment and to participate in the community? Edwin, are you raising your hand to go first?
Yeah,
All
yeah,
right.
I'll take shot. I think it was said a couple times. I think active listening. Don't assume that you're the expert. Trust the community and what they're saying their needs are. I think too many times we want to go in and just assume what each community is dealing with and what is driving their violence. What I've learned over the past 3 years at UCAN is that each of our communities have their own dynamic, and there's different incidents that are occurring in the community that are not tied to another community, right? So everybody, it's we need to approach this as there's no one fix to everything, and I think that just listening, active listening, taking the community at their word and their needs, and um, trusting the experts that you're working with as well. Like we're co-developing things together.
Thank you.
Yeah,
Kathryn, Kelly, any other
I can,
suggestions for new researchers?
I'll offer just briefly. I think the one piece of advice I would offer is to find an organization or a community-based group that's doing work that you really care about, and just start to build relationship and put yourself out there, and don't necessarily approach it from a place of, I really want to be able to, like, don't show up and say, I'm a researcher, I want to collect data. Show up and say, I care really deeply about what you do and I want to understand it better. Would you be willing to spend some time with me, helping me to learn and more about what you do, and just build a relationship and approach it the way you would build any relationship? And I think a lot can flow from that.
I love that because the research will be so much stronger as a result of that, establishing that relationship first. Kathryn, anything to add to that?
Sure. I want to give a shout out to the Black and Brown Collective for Community Solutions to Gun Violence. They have a really great website, the bbcollective.org. There's some wonderful reports that I think answer this question that you can download there. And even a mentee program for early career scholars or doctoral students who are trying to figure this out. There's webinars that are hosted. But I think just to answer your question at a different level, everyone possesses some kind of skill or resource that they're able to share. I've known music artists, um, people who are in healing arts who show up wanting to do something, and that anything can be offered in service of the community as long as you're willing to make a solid and consistent engagement and commitment. And so I think those are ways to begin building relationships so it doesn't seem as extractive or, yeah, for one's personal gain versus collective healing and repair.
Thank you. And thank you for the shout out to the Black and Brown Collective. I encourage people to Google that group and check out those research resources that you mentioned. Um, I do see some questions are coming in the Q&A. I want to let folks know we're out of time, but we are going to take a look at those questions and do our best to get answers to folks as we can. I want to tell our panelists thank you so much, and I can't wait to see what happens next for you all and the important research that you do. And just thank you so much for what you're doing for the communities that you're working with, but also for taking the time to join us today to be part of this webinar. And speaking of what's coming next, I want to mention that our next webinar in this series is going to be titled From Problem to Purpose, Choosing Research Questions That Drive Change in Firearm Violence Prevention. And we're fortunate to have Dr. Ali Rohani Rebar, Darrell Green, and Christina Umali, who will be sharing their experience and their expertise with us about one of the most important early stages of effective research, choosing the right question that resonates with the community and also meets the needs of the funder and is of relevance to you as a researcher. So please join us for that webinar on March 27th. And for everyone who joined us today, there's going to be a brief survey at the end of the webinar. Your input's really valuable to us, so I encourage you to please take that survey. Kathryn, Kelly, Edwin, thank you so much. I really appreciate you joining us today. Learned a lot.
Thank you.
Thank you.
Bye, everyone.